Are you a golfer who would like to have more consistency in your golf swing, more efficiency, possibly less injuries, and take a couple strokes off your game? If so, this is your next step. Join me, Christine Hayes, physical therapist and functional movement specialist, and TPI medical professional, that's Titleist Performance Institute, and KVEST certified professional, for the next phase in your golf analysis and golf game. Patients come to see us oftentimes with golf injuries, and some of those injuries are directly related to mobility and stability issues throughout the body that they just don't have for their golf game. So we see them first in the door through injuries, and we oftentimes will make those corrections and also do manual therapy and joint mobilizations to improve those areas so that their golf game gets better. We also see folks that come in that are not injured, but just want to improve their golf game. So the next step is a Titleist Performance Institute examination, which I will perform here in our physical therapy practice located in Paoli, Pennsylvania. The TPI exam is a 16-tiered examination specific to your golf game. And once we have that information about mobility and stability issues that you may be having in your golf swing, it's very easy to find the best correctives to quickly start to correct some of those problems for you so that your swing gets better, more efficient, and you have less injuries. So that's the first step. The second step is a KVEST biofeedback testing and training system, which we have. We do it indoors year-round, and this is an amazing system. It's wireless. It captures three-dimensional movements of the torso and the pelvis, primarily with flexion or bending forward of the torso and the pelvis, extension, rotation of pelvis and torso, and side bending. And it captures this in your setup from your initial posture through your backswing, top of the range, down through impact. We capture that and we do a multi-swing analysis. So we see, okay, is this person swinging efficiently for maybe a series of 10 swings? If we have any duds, we kick them out of the study. So we really hone in on where you're having problematic areas. And from that information and the TPI information, we design an amazing golf program for you. That is both golf correctives from a fitness perspective, incorporating any manual work that you might need, because as a medical professional and a physical therapist, I can do those things. Joint mobilizations, manual therapy, ART, whatever is needed, and also determine, why are your hips not moving well? Is it moving well because you have a tight muscle? Maybe not. They may not be moving well because there's some restrictions in your joint capsule or your ligaments that only a medical professional can really address for you. So all of that will be addressed in your corrective program. The second half of the program is a lot of fun because that's all about KVEST. So you have your own little avatar that matches up to our computer program, and you see and hear from a biofeedback perspective, are you in the proper ranges? Proper ranges are compared to the PGA and the LPGA averages. Now we know that a lot of amateurs are not going to be perfect in those averages, and we can make adjustments for that. But we do shoot for those goals because that is the correct sequencing of movements. And then we also say, okay, from the top of the range, is this person leading with the correct sequence? That correct sequence is the same for golf as it is for tennis, as it is for baseball. And that is the kinematic sequence, leading from your hips and your pelvis first, and your core, followed by your torso, followed by the shoulder, followed by the club. And we can see that in your testing, and we can train it. So lots of valuable information comes through, whether you have an injury or not, whether you just want to play better and have fun. All of it starts with your first evaluation session for the TPI assessment and KVEST, and then we take it from there and we have a lot of fun. So again, my name is Christine Hayes. I'm a physical therapist, been a physical therapist for 30 years, have a passion for golf, love it. I use the K-Vest system myself, and not only do I use it, but Ricky Fowler uses it. A lot of players on the tour, Charlie Hoffman, Adam Hadwin, countless others use this year-round. So why not use this device that you have here with the guidance of a medical professional? Not only that, I love to work with your golf professionals, so it's a team approach. So once we get you moving better, swinging better, then your golf professional, all three of us can be at the center of your team to make your golf game funner, better, with less injuries, and keep you going with the things that you love to do. My phone number is 610-695-9913. Call and we'll get that evaluation underway as soon as possible.